Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Posture and Chiropractic Clinic. This video has to do with stabilizing your your torso, not just your upper extremity, but your torso, implementing your oblique muscles to work in side-to-side movement. So stay tuned. Okay, so one of the major players in stabilizing the torso are the oblique muscles. The way people work on their abdominal obliques and transverse abdominis muscles is this one. How many of you have done this and the next morning you didn't feel it in your oblique muscles but in your neck? It's easy to go from point A to B thinking you're working on these things, but you're not doing it correctly. Babies do not do these types of exercises to develop the muscles. So why do we need to reinvent the wheels if we can learn from babies? No matter what part of the world these babies are from, they all move the same way. We all have moved the same way. You and I have moved the same way as babies. So we need to use those principles to develop strength, to develop proper tonicity into your muscles. The alternative to what I just showed you is a side-to-side movement that babies do at around 4 months or so of age. So I've done another video on how to engage your barrel. We're going to make sure that we put at the end of this video, and also how to position yourself on the floor to start the side-to-side move. We're going to make sure you see those videos. Make sure you do, because otherwise it's easy to duplicate what I'm doing but not do it correctly. It's all about doing the exercises correctly. So with that said, I'm using those same principles to position myself. My shoulder blades not lifted up. What is up in the air is just my arm length. I am not bending and keeping my spine neutral and against the floor because my hips are in, not my hips, but my legs are in, pushing my pelvis into the floor, but my lower ab is engaged. And I keep this rectangular. That means it's not going to be twisted. It's not going to be bending. It's going to stay rectangular. As I stay right there, I'm gliding my neck back and keeping it in position. So my lower half is not farther down to the floor while my upper part of the rectangle is away. And then of course you do it on the other side as well. What moved me was my whole torso, but the spotlight was on my obliques. So one oblique initiated, the other one supported, helped in supporting it. During this movement, during this exercise, the side-to-side movement that babies do before they roll over, that's what's needed to develop these muscles. The rest of my body, my arms and my lower extremities, will learn to support their own weight in this movement. It's a beautiful concert. Imagine the spotlight is on the pianist, but everyone else is still playing their musical instruments. That's what functional movement is. That's what dynamic neuromuscular stabilization, or DNS, is. This is how it plays a role with postural neurology, both of which are the essence of my postural treatment for all of my patients, from active patients to professional athletes to regular people who want to move not be injured, and not to have any pain. If you have any questions or comments, please approach me through one of the methods of contact, which you will find in the description box. Make sure you subscribe to my channel and listen to my podcast. All of that information is still in the description box. Until next time, take care.